Signposting guides the interviewer through your answer with signals. It will break up your answers and compartmentalize each section to make it clear you have covered one point and are moving on to the next one. This is an exceptionally useful tool to bring out on the interview day, and when done well, it can really make an answer sound a lot more polished. It gives your answer structure and makes it sound a lot clearer and easier to follow. Having previously assessed candidates in the interviews, this technique is surprisingly easy but exceptionally effective. It really makes an answer sound more systematic and controlled, giving the interviewer the impression that you possess those qualities too. The tricky part is to strike the balance between having a clear order to your answers without making it sound too prescriptive. You still want to sound natural. The classic example of signposting is the firstly, make a point, secondly, make a point, lastly, or overall, I think, make a point. Another frequently used signposting technique is when you have two sides of an argument and you say, on one hand, we have followed by some detail, and then on the other hand, something by some more detail. So these two examples are fine to use for one of your answers, but if every question uses the same signposting technique, it isn't going to come across well. There's a document with a few signposting phrases attached that you can use and have a look at if you need some inspiration. So we'll have a look at an example of signposting in an answer. So this is answering the very standard question, why do you want to study medicine? And this is signposting at the start. So you can set up the answer with a short, non-rambling introduction. There are lots of reasons I like medicine. Then signpost and expand. Firstly, I saw firsthand on my work experience the satisfaction that can be gained from treating an illness, and then give more detail with an explanation. And then signpost and expand. As well as this, I have a strong interest in research, and I feel that a medical degree would allow me to pursue the interest further. Once again, signpost and expand. Finally, I really enjoy working under pressure and in close cooperation with other colleagues, and then expand some more. Alternatively, you can signpost at the end of your points. Normally this is done by talking about a topic you were asked about and then explaining the relevance to the question at the end. So to the same question, why do you want to study medicine? So the intro part, during my work experience, I saw firsthand the empathy that doctors had to show patients when delivering bad news. They ensured the patient and their family members were present in a quiet place and gave another team member their bleep to ensure it didn't go off during the consultation. Taking these steps allowed the doctors to give the family their whole attention and to answer any questions they had fully. They used simple language to explain the complex cause of the disease. And then signpost. I felt this showed how medicine is a field that provides an ideal opportunity to apply both interpersonal and academic skills. So you don't have to use this for every answer, since not every question needs it, but when you can, do. You'll probably find that you naturally use signposting of sorts to break up your speech for extended periods of time anyway, but after practicing it in a more regimented way, it sounds incredibly simple, but when sitting on the other side of the table, it makes this answer sound a lot more structured, and it's something that the interviewers definitely appreciate.